When it comes to dental implants, there are many options. If you have a single tooth that's missing and we need to replace it with a single implant, there are three parts to it. There's the surgical part, which is the metal implant that goes in the bone. There's the abutment, which is a metal post that screws into that implant, and then there's a crown that goes on top of that. Once a tooth is taken out, it takes about 4 months for the bone to fill in the socket where that tooth originally was. Once the bone is solid, we can put the implant in. That's a small surgical procedure, and then it takes about 3 to 4 months for the bone to grow around that implant and hold it in place. After that, we can start making the crown to replace the missing tooth. So the entire process of replacing a single tooth with an implant takes about 2 to 10 months after the tooth is taken out. If a patient comes into the office with a missing tooth, we give them many options, one of which is an implant. If the patient would like an implant, we're going to do a CT scan. We're going to evaluate the bone quality and the bone quantity in the area where we'd like to place the implant. Only after we analyze that three-dimensional X-ray, that CT scan, will we decide whether the patient is a good candidate or not for an implant. Many patients are surprised at how little discomfort they have when we place an implant. Generally, the procedure is relatively simple, and in most cases, it's a whole lot easier and more comfortable than getting a tooth taken out. We do a lot of planning in advance. When the patient comes into the office, we give them a local anesthetic. They don't need to be sedated, and in fact, I would recommend they not be sedated. We'll place the implant, and what we like to do is at the end of the procedure, we provide a long-acting anesthetic. We'll give them an injection for an anesthetic that lasts about 10 hours. That's going to get them through all the initial discomfort after the procedure. And when that 10-hour anesthetic wears off, usually they're good to go and they really have very little discomfort even after the procedure. If a patient comes into our office and has a missing tooth, we'll give them 4 options. Option number 1 is going to be leave a space. There's always that option. It's not an ideal option. The teeth around it can start shifting. It makes it tougher to keep those teeth clean, and you can ultimately end up losing more teeth. Option number 2 would be a removable appliance. That would be a denture. We can make a denture with a single tooth or a denture with multiple teeth. That's something that's going to have to be taken out at night. You snap it in the morning, you take it out at night, and it would replace whatever teeth are missing. It is a lot of plastic in your mouth. It takes some getting used to, but it is a functional replacement for a missing tooth. Option number 3 would be a bridge. With a bridge, we need to have solid teeth on either side of the space. We will trim those teeth as if we're going to put a crown on the teeth, and then we'll cement. Basically, it's a crown on each side and a fake tooth in the middle, and they're all connected. That can work real well, but the problem is that it's very difficult to keep the area clean. You can't floss around it the way you could a natural tooth, and if you get a cavity under the bridge, the entire bridge needs to be replaced. And so often it isn't long-term an option as an implant would be. Which brings me to our 4th option, an implant. An implant is a man-made root of a tooth that we put in the bone of your jaw. We connect it with what we call an abutment, or a metal post that screws into that implant, and a crown on top. And it doesn't affect the teeth on either side. It replaces your tooth, and it is the best option. What's nice about an implant is you can't get a cavity on it. You can still get gum disease around it if you don't take care of it, but you can't get a cavity. And if something happens, piece breaks, you replace that one tooth. It doesn't affect the teeth on either side. You can floss it, brush it, just like a natural tooth. And in most cases, that is the most long-term option that we have. Generally, implants are the longest lasting tooth replacement option that we have. Even though it can last many, many years, often a lifetime, sometimes things do go wrong. If we do notice early on that there is some bone loss, often that can be treated and we can have a good recovery. If the implant does have to be removed, often the implant would be removed. We could do some bone grafting, and in many cases, the implant can be replaced in that same location. The wonderful thing about implants is that it gives us many, many options. If you have a single tooth that's missing, we can replace a single tooth with an implant. If you have a couple of teeth that are missing, we can replace them with just a couple of implants. We can connect bridges to implants rather than natural teeth. So if you're missing three teeth on one side next to each other, we could put in two implants and connect it with a bridge. If all of your teeth in an arch are in curve shape, we can replace all of those teeth with an implant-supported prosthesis. We have a system called All-on-X, which you may see on TV, teeth in a day, and that can be done. What would happen is the teeth are taken out. We do a whole lot of planning in advance of that, but the teeth are taken out. Implants are put in on the same day. We have a lab technician that comes to our office and makes an appliance for you while you wait. And in many cases, we may actually do that the next day. And that is placed in your mouth, and you have teeth almost immediately. Those teeth are just a temporary. We wait about 6 months for everything to integrate, and then we start from scratch and make a new prosthesis that's going to be connected to all of those teeth. And that could be a great way to replace all of your teeth if necessary. Implant maintenance is almost exactly like taking care of your natural teeth. You brush them, you floss them, and you do have to floss a little bit higher just because the diameter of that implant is a little bit narrower than the natural tooth. But other than that, it's just like a natural tooth.